Whiplash and chronic pain solutions. Unfortunately, a lot of people are injured in car accidents and they have pain that follows them for a long period of time. In whiplash injuries, you can have a variety of body parts that are injured. Obviously, the main one is your neck. It can be your middle back. It can be the lower back. You can hit your knee on a dashboard. You can pull your shoulder outside of the seatbelt or in the seatbelt. You can get rib injuries and so on and so forth. So I'm going to basically focus on the spine, although we do see people that have extremity injuries from whiplash. Just quickly, I want to bring you back up to speed on the whiplash numbers, the car crash numbers, and so forth. So United States car crash stats. We have 109 people that die per day in the United States. That's two people per state per day. There are 12,300 injuries per day. That's what we're going to be talking about here. People that get injured, that need treatment, and people that might have chronic pain for weeks, months, and years after an injury. So 12,300 people are injured per day. There are 16,000 car accidents per day in the United States. That is 6.2 million accidents per year, 6.2 million accidents. And out of those 6.2 million, 4.6 million people are injured. So not every accident results in an injury. There can be a small fender bender that might be reported and so forth, but there's nobody injured. There's just property damage or something like that. A car hits something, but nobody's injured in the car, right? So you can have an accident, but no one's injured, which that would be nice if it was in every case, because we can always fix cars and property. But those are the numbers. And then lastly, the costs. $820 per person per year is just per year for the cost of paying for all of these accidents and injuries and so forth. And that is $230 billion a year just in the United States. So that's what we're up against here. Okay, let's talk about tissue injury. So what tissues are injured when you get into a car accident? What happens, okay? Think of a whiplash injury like a sprained string. And I explain this to any patient that comes in with virtually any problem, because everybody seems to be able to wrap their head around a sprained ankle. Let's say we're playing basketball, I roll my ankle, now I'm hobbling around, I'm in pain, it swells up the next day and I'm still hobbling around and so forth, okay? What's interesting is I can go get x-rays. Let's say the x-rays are negative, meaning no broken bone. Let's say the pain is perpetuating and I get an MRI, and let's say that the MRI is clean. There's no tear seen on MRI, but I'm still hobbling around, I'm in pain, it's still swelling and so forth. What is wrong? The tissue injury is a sprained strain. Most of us, if you don't have a serious injury after a car accident with broken bones needing collars and halos and surgeries and so forth, I'm not talking about the severe injuries. I'm talking about the mild to moderate injuries that don't require that kind of an intervention in the beginning, right? So it's a sprained strain. When we say sprained strain, that is a soft tissue injury, not bone, everything else. What is everything else? Ligaments, cartilage, the joint tissues, muscles, tendons, nerves. There we go. All of the soft tissues is what a sprained strain is, okay? If we look under a microscope, what happens is, this is your tissue under a microscope. Let's say, once again, somebody has neck pain, x-rays are clean, they get an MRI, and the MRI comes back normal, but they still hurt. Why is that? If we take a section of their tissue, if we take a section of the cartilage disc, the ligaments of the spine, the muscles and tendons, we take a little section out, we put it under a microscope, we see this. We see a tear. Maybe we see a bunch of them called micro tears. These are micro tears, too small to see on an MRI, but big enough, but we could see them under tissue dissection, if you will, okay? So we know that those tissues are sprained. And then what happens over time is these tissues mend with scar tissue. So when you have a sprained strain, you heal with scar tissue. Scar tissue would be, in this case, fixing this piece of paper with glue and tape. Now, having glue and tape is better than having the tear remaining the entire time. Let's fill it in. Let's fill it in with glue and tape, But the glue and tape area is not the same as the original area, is it? That's scar tissue. Scar tissue is like fixing the rust hole in the car with body filler Bondo. It's better than having a rust hole, but it's certainly not like the original sheet metal or plastic, right? So that's what's going on here. The tissues are torn, sprain, strain. They fill in with scar tissue. That's the repair. That's the normal repair of the body. Then you have scar tissue, okay? Now, what's the problem with scar tissue? Scar tissue is weaker, stiffer, and more painful than the original. Weak, stiff, and more painful. And what happens is when I ask somebody, how is their neck doing? Is your neck weak? Yeah, it doesn't feel as like strong. It feels like my head is 100 pounds. Is it stiff? Yeah, I don't have the full range of motion that I used to. And are you in pain? Yeah, I kind of hurt more than I do after the accident than before. You see? So that's the qualities of scar tissue. Weak, stiff, painful. And then I get a phone call. And in that phone call, what you need is an evaluation. You need a proper evaluation. And when somebody comes in and I take their history and they say, I was great, 10 years ago I got rear-ended, and ever since then I have not been the same, I tell them everything I just told you. I say you have an ankle sprain strain, you tore the tissues, they repaired with scar tissue. Scar tissue is like glue, it doesn't work as well, it's weak, stiff, and more painful. Okay. Then in that evaluation, we're going to do orthopedic, neurological, range of motion, chiropractic checks, postural checks, and so forth. If somebody hasn't had x-rays or recent x-rays, very likely we're going to take some x-rays and just see the overall condition and position of the spine, right? Because we know in that whiplash injury what happened. Let's say this is the most common one, right? So we're sitting there, we're hanging out, we're at a red light, foot's on the brake, minding our own business, unawares, boom, we get rear-ended. Let's say it's not severe. Let's say we get it rear-ended at 10 or 15 or 20 miles an hour, something like that, okay? So you get rear-ended, just like you can see this neck here moving. See that move like that, right? This is what happens. It's like getting a football hit, but you didn't know it was coming. And you can see how quickly your neck moves like that. See how quick it happens? It's like 0.2 of a second, and it's over. And then after it happens, it's like, how many of us, unfortunately, if you've been there, like I have, you're like, what happened? I don't even know what happened, because it happened so fast, okay? Now, you don't even have to have car damage. If you have a 2-ton car hitting a 2-ton car, and then you have a 15-pound bowling ball on a little tiny popsicle stick, and you run through the basics of physics, and then you start realizing how much that moved in 0.2 of a second without muscular protection, you realize, gee, I just injured the cartilage discs, the ligaments, the facet joints, the muscles, the tendons, the nerves, and so forth. Okay? So they get injured that quickly, and that's what happened. And that's why we're going to go ahead and we're going to take those x-rays if necessary, again, depending on what kinds of studies have done, how long ago the accident was, how severe it was, and so on and so forth. That's part of the evaluation process, and then we describe that. Okay, so that's what's happening to most people if you're having pain afterward. The very fortunate person is the one that gets in the accident and has no pain afterward. That's really good. Then you just fix the car and who cares, right? Well, then what do we do about this? So then we have treatments and solutions. Treatments and solutions. Of course, I'm a chiropractor, so I do chiropractic stuff. Now remember, if you're not familiar with chiropractic, a lot of people, when they have never gone, they always think it's cracking and popping. But if I have an infant, or I have somebody who's 85, or if I have somebody under a fresh whiplash that might have ligament instability, or spinal stenosis, or literally a compressed nerve, I'm not going in there and going crack, crack. Or the person that comes in and says, I don't want that manual adjustment, that's fine. The majority of patients that come into my office do not receive those adjustments. Okay? So we can get people better. We can start reducing that scar tissue, breaking up those fibrinogen, collagenous scar tissue adhesions, break up that glue by doing other types of adjustments and techniques. You follow? The way we do it is liking it as two sheets on your bed. If the sheets are free, they are sliding on one another nicely. That's how all of your connective tissue in your body is supposed to work. But if I put a piece of Velcro in there, now we've got a place that's stuck, or maybe there's a whole bunch of Velcro that's stuck in different places. Now the tissues don't work right. Well, we got to go in there, and if you will, pull that tissue out. And we can do that with chiropractic adjustments. And we can do that with number 2, specific spinal exercises to pull those tissues along the lines of stress and strain to break up those collagen glues that are in there, right? The third thing that we do is general physical exercise. Every time you increase your fitness, you're going to increase blood flow. Blood flow is going to bring nutrients into tissues and pull waste products out. Things heal better. More oxygen, more healing. Pretty simple. I have a laser, a therapeutic laser in my office. Again, some people that are under chronic pain already tried chiropractic, physical therapy, acupuncture, massage, whatever they have done. They're still not getting better. Maybe I choose to use laser often because it's something they haven't done yet, and that can be the thing that puts them over the edge into the healing conundrum. Then we do anti-inflammatory supplements. People are boiling hot cauldrons of inflammation, particularly in the United States. So we need to knock down that inflammation. We can do that with anti-inflammatory supplements, omega-3 fish oil, a variety of vitamin and minerals that are antioxidants, magnesium. Maybe we have to repair the gut with pre and probiotics and digestive enzymes and so forth. Along the list goes, but that would be a good start, the ones that I just mentioned. We talk about those in other shows. An anti-inflammatory diet. An anti-inflammatory diet would be more of a pagan diet, if you will. High in vegetables, little bit of fruit. No soda, no juice, no sugar, and so on and so forth. High in vegetables, as Dr. Mark Hyman likes to say, a pagan diet. I agree with that. We need to reduce stress. Stress reduction techniques that we've talked about here, and you can get into that. Reducing stress reduces inflammation, reduces chronic pain. Sleep, of course, if you get enough rest, you get enough regeneration and repair. And of course, drinking enough water and making sure your body is hydrated. So that's something that we can do as well. You refer back to my shows where we discuss these things. So when somebody comes into me with a chronic pain scenario, oftentimes with whiplash, this is the program that we put people in, and they can plug themselves in, and the more of these things on the list that they do, the higher the propensity they're going to have of getting a better result. I can't make any promises, but what I try to do with most people is at least get them better than they were when they started coming into my office. Better than you are now. And if it ends up being a little, that's great. If it ends up being a lot, wonderful. And if we completely remove your pain, that's just extraordinary. I'm Dr. Scott Fuller.